My name is Dr. Audrey Larkwell, and I want to begin with something most women never expect to hear from a healthcare professional. You are not losing your mind. You are not falling apart. You are not becoming someone you do not recognize, and you are not too sensitive. You are in a transition, a profound, systemic hormonal transition that the female body moves through somewhere in the decade before menopause. And almost nobody properly explained it to you before it started. That is why you are here, because something has changed. Not just one thing, several things. And they feel connected, but nobody has connected them for you yet. Your period used to be predictable. Now it is not. Your sleep used to restore you. Now it wakes you up at 2 in the morning and refuses to return. Your mood used to feel like yours. Now it shifts faster, more intensely, in ways that make you question yourself. Your waist used to respond to what you ate and how you moved. Now it seems to have its own agenda. Your energy used to carry you through the day. Now it runs out before the afternoon is over. Your mind used to be sharp. Now words disappear mid-sentence. Your skin and hair used to feel familiar. Now they feel thinner, drier, different. Your body used to feel like something you understood. Now it feels like something you are constantly trying to interpret. And the most painful part is not the symptoms themselves. The most painful part is what most women do when they experience them. They blame themselves. They say, I must be more stressed than usual. They say, I need more discipline. They say, I should sleep earlier. They say, I should eat less. They say, I am just getting older. They say, maybe I am overreacting. But what if none of those explanations is the real one? What if the real explanation is one that has a name, a clear biological mechanism, and most importantly, a real path forward? That explanation is perimenopause. And today I want to walk you through the 10 signs that your body may already be sending. Not to alarm you, not to diagnose you, but to give you what you deserve and have probably never received. Clarity. Stay with me. Before I begin, I want to tell you why this topic is not just professional for me. I am a specialist in menopause wellness. I have spent the better part of 2 decades studying what happens to the female body in the decades of hormonal transition. But my understanding of perimenopause did not become fully real until I began living it myself. I was 42, and the first sign was not dramatic. It was quiet. My period arrived a week and a half early. Then the following month, it was late. Then it was heavier than it had been in years. Then it was barely there. In the space of 4 months, the cycle that had been one of the most consistent rhythms of my adult life had become unpredictable. I told myself what I would later hear thousands of women tell themselves. It's stress. It's the travel. It's nothing. But I knew, in the way that I believe most women know before they allow themselves to say it out loud, that something had shifted. Then the night waking began. Not always accompanied by sweating, sometimes just a sudden alertness at 3 a.m. that did not exist before. A mind that was on when the body should have been resting. And by morning, a fatigue that no amount of early bedtime seemed to resolve. I was a specialist in exactly this area. I knew the physiology. I had counseled hundreds of women through it, and I still spent months minimizing what I was experiencing. Because there is something about moving through a health transition yourself, as opposed to studying it, that changes the knowledge completely. It becomes embodied, it becomes compassionate, it becomes personal. And that is what I want to bring to you today, not just the science. The second sign is one that most people have heard of, but very few people adequately prepare women for. Hot flashes. A hot flash is not just feeling warm. It is a sudden wave of heat that begins in the chest or face and spreads throughout the body. The face flushes. The skin may redden, sweating begins, the heart may beat faster, and the whole episode can last anywhere from a few seconds to several minutes. Then it fades, often leaving a chill. The mechanism involves the hypothalamus, the brain structure responsible for temperature regulation. As estrogen fluctuates, the hypothalamus becomes less stable in its temperature setting. Small changes in body temperature, ones the hypothalamus would have previously ignored, now trigger a heat-dissipating response. The body dilates blood vessels, it initiates sweating. It generates the wave of heat, even when there is no actual external cause. Hot flashes can happen several times a day. They can happen at night, in which case they are called night sweats. They can be mild or intense, brief or prolonged. And for many women, they begin in perimenopause, sometimes years before the final period, as estrogen begins its unpredictable fluctuation. The emotional impact of hot flashes is something that is rarely discussed enough. They can be embarrassing in professional or social settings. They can make a woman feel conspicuous in a moment when she wants to be invisible. They can arrive at the worst possible times. And they can create a background anxiety, the low-level wondering of when the next one will come, that wears on a woman across weeks and months. If you are experiencing hot flashes, please know that you are not imagining them. They are real, they are recognized, and they deserve real support. The third sign is the nighttime version of the second, and in my clinical experience, it is the one that most affects the quality of daily life, because it steals the one thing the body cannot afford to lose: rest. Night sweats are hot flashes that occur during sleep. Sometimes they fully wake you. Sometimes they only partially disrupt sleep, enough to prevent the deep, restorative stages without fully bringing you to consciousness. Either way, the result is the same. You sleep the hours, but you do not get the rest. And beyond the night sweats themselves, many women in perimenopause experience a more general fragmentation of sleep, waking at 2 or 3 a.m. without a clear reason, lying awake with a mind that will not quiet, a lighter overall sleep that feels less satisfying no matter how many hours it occupies. This happens partly because progesterone, which has natural calming and sleep-promoting properties, also declines during perimenopause, and partly because the hypothalamic instability that drives hot flashes also affects the sleep-wake regulation that the hypothalamus governs. The cost of this broken sleep extends far beyond tiredness. Sleep disruption elevates cortisol. Elevated cortisol increases appetite, particularly for high-sugar, high-carbohydrate foods. It promotes abdominal fat storage. It impairs insulin sensitivity. It worsens mood regulation. It intensifies brain fog. It makes stress feel harder to manage. Every system in the body that depends on overnight restoration is affected when sleep is consistently fragmented, which is why addressing sleep is not just about comfort during perimenopause. It is about metabolic health, emotional health, and cognitive function. The fourth sign is the one that causes the most self-blame and the most unnecessary shame. Mood changes, the irritability that appears without adequate cause, the tears that come more easily, the anxiety that settles into the chest before the day has made any real demands, the emotional rawness, the feeling of being less like yourself, and then, almost universally, the guilt. Why am I reacting like this? Why am I so sensitive? What is wrong with me? Here is what I want every woman to understand. Estrogen and progesterone both have significant effects on the neurotransmitters that regulate mood. Serotonin, the neurotransmitter most associated with emotional well-being. Dopamine, the neurotransmitter associated with motivation and reward. GABA, the neurotransmitter that provides the brain's natural calming signal. When estrogen and progesterone fluctuate, these neurotransmitter systems become less stable. The mood regulation system becomes more reactive. Smaller triggers produce larger responses. Emotions that used to feel manageable now feel more intense. This is not a character flaw. It is a neurochemical consequence of hormonal fluctuation. And when it is compounded by broken sleep, which independently impairs emotional regulation, the mood symptoms of perimenopause can become very significant. Add the stress of navigating midlife responsibilities while also managing physical symptoms nobody told you to expect. Add the cultural pressure to continue performing in every role at the same level while silently adapting to a major physiological transition. And it becomes clear why many women in perimenopause feel, as one of my patients once told me, like they are holding everything together while quietly falling apart inside. The mood changes of perimenopause are real. They deserve acknowledgement and they deserve support. The fifth sign is the one that is most visible, and because it is visible, it carries the heaviest emotional weight: the belly, the waist that has changed, the midsection that feels different, softer, fuller, more resistant to what used to work, and the relationship with the mirror that has become more complicated. Let me explain what is happening. As estrogen fluctuates and begins its gradual decline in perimenopause, the body's fat distribution pattern changes. Fat that would previously have been stored preferentially in the hips and thighs driven by the estrogen-dominant hormonal environment of the reproductive years, begins to shift toward the abdomen. This is visceral fat, fat stored deep in the abdominal cavity, around the organs. And visceral fat is metabolically active. It produces inflammatory compounds. It is more strongly associated with insulin resistance than subcutaneous fat. It is more resistant to conventional diet interventions, and it tends to accumulate further when sleep is disrupted and cortisol is chronically elevated, both of which are extremely common in perimenopausal women. This is why the belly of perimenopause does not respond the way the body used to respond. It is not the same fat driven by the same conditions. It is visceral fat driven by a changed hormonal environment, elevated cortisol, reduced insulin sensitivity, and the muscle loss that accompanies midlife in the absence of deliberate resistance training. And the approach that works for this body is not the same approach that worked for the body of 20 years ago. It requires addressing the hormonal and metabolic root, not just restricting calories. If you are recognizing yourself in these first 5 signs, the irregular periods, the hot flashes, the broken sleep, the mood that does not feel like yours anymore, the belly that will not respond, then I want you to take one simple step. The link in the first line of the description below was created for exactly this moment. It introduces the approach I recommend to every woman navigating this transition: the lifestyle strategies, the natural support options, and the daily practices that work with the body instead of against it. Click the first link in the description, and then keep watching, because signs 6 through 10 and the natural daily formula that addresses the metabolic picture behind all of them are what most women never hear about until years into this transition. The 6th sign is one that affects professional confidence in a way nothing else quite does. Brain fog. The word that disappears mid-sentence. The name that was just on the tip of your tongue. The room you walk into and stand in for a moment, having completely forgotten why you came. The thought you were just having that simply isn't there anymore when you reach for it. The reading you have to do twice. The focus that scatters. The sharpness that has been replaced by a slight, persistent haze. And because brain fog is invisible, because no test will confirm it in a doctor's office, because it does not show up on a scan, women often suffer through it without acknowledgement. They laugh it off. They make jokes about being forgetful. They cover it with humor to hide the private worry that something more serious might be happening. Let me give you the reassurance that most women in perimenopause need to hear. Brain fog during hormonal transition is real. It is recognized, and for most women, it is not a sign of neurodegenerative disease. Estrogen plays neuroprotective roles in the brain. It influences blood flow to the brain. It affects the function of the neurotransmitters involved in memory, focus, and cognitive processing. When estrogen fluctuates, these functions are affected. Add sleep deprivation, which independently impairs every aspect of cognitive function, and the brain fog becomes both more understandable and more significant. Important: if cognitive changes are sudden, severe, or rapidly worsening, or if they are accompanied by other neurological symptoms, please seek prompt medical evaluation. Perimenopause-related brain fog is typically gradual and correlated with other hormonal symptoms. Sudden or severe cognitive changes always deserve professional attention. The 7th sign is the one that changes the quality of every single day. Fatigue. Not the ordinary tiredness that responds to a good night's sleep. The deep, persistent fatigue of a body running on incomplete recovery. The heaviness that arrives with the morning. The energy that peaks briefly and then runs out before noon. The afternoon that becomes a negotiation with the body about how much more can be asked of it. And the evening that ends in exhaustion before anything restorative has been possible. Fatigue in perimenopause can come from many places simultaneously. Broken sleep draining the overnight restoration. Night sweats preventing the deepest sleep stages. Cortisol elevation from both the hormonal transition and the accumulated stress of midlife. Blood sugar instability, driven by declining insulin sensitivity, creating energy crashes that leave the body depleted. Muscle loss reducing the metabolic efficiency that used to produce steady energy. The emotional labor of managing symptoms that nobody around you can see or fully understand. And the nutritional gaps that develop when a busy, demanding life does not leave time for genuinely nourishing meals. Fatigue also has other causes that deserve investigation. Thyroid dysfunction is extremely common in midlife women and produces fatigue that can overlap significantly with perimenopause. Anemia, vitamin D deficiency, vitamin B12 deficiency, and iron deficiency all produce fatigue and all become more common in this decade. If fatigue is significant, please have blood work done. Do not let a busy doctor dismiss fatigue in a perimenopausal woman as simply hormonal without ruling out treatable causes. You deserve a complete evaluation. The eighth sign touches something most women feel but few are comfortable discussing, because it affects how they appear in the world and how they appear to themselves. Dry skin, the skin that feels less hydrated, less elastic, less luminous, that shows lines it did not show before, that feels sensitive in ways it never used to. And thinning hair, more strands in the brush, more shedding in the shower, less fullness around the hairline and crown, a texture that has changed, finer, more fragile, less resilient. Estrogen plays a direct role in both skin and hair health. It stimulates collagen production. It maintains skin moisture and elasticity. It influences the hair growth cycle. As estrogen fluctuates and begins to decline, collagen production decreases. Skin becomes drier, thinner, and more reactive. And the hair growth cycle shifts in ways that produce more shedding and less regrowth. These changes are real. They are not vanity, and they deserve both understanding and care. Important: hair loss and skin changes in midlife can also be driven by thyroid dysfunction, iron deficiency, protein intake, stress, medication effects, and other treatable causes. If these symptoms are significant, investigation, rather than assumption, is the right response. But in the context of other perimenopausal symptoms, irregular periods, hot flashes, mood changes, fatigue, skin and hair changes are part of the same hormonal picture. The ninth sign is one that most women attribute to something else entirely: the stiffness that arrives in the morning, the joints that ache in ways that feel disproportionate to activity, the muscles that recover more slowly, the body that feels more fragile, more sore, more sensitive to effort than it did a decade ago. Many women blame their exercise routine, or their age, or their mattress. And while all of those can contribute, what is often missing from the explanation is the hormonal dimension. Estrogen has anti-inflammatory effects throughout the body. It influences joint health, cartilage integrity, and the body's inflammatory response. As estrogen fluctuates in perimenopause, the reduction in its anti-inflammatory protection can contribute to increased joint sensitivity, muscle soreness, and the general sense that the body is more physically reactive than it used to be. Add the sleep disruption that prevents overnight muscular repair. Add the increased cortisol that promotes inflammation. And the body aches of perimenopause become both understandable and addressable. They are not simply something to endure. They are a signal that the body's inflammatory environment has changed and may benefit from targeted support. Important: significant, sudden, one-sided, or rapidly worsening joint pain, or pain accompanied by swelling, redness, fever, or other systemic symptoms deserves medical evaluation. Arthritis, autoimmune conditions, and other causes of joint pain can develop in midlife and should not be dismissed as simply hormonal. But diffuse, bilateral, gradually developing joint and muscle sensitivity in the context of other perimenopausal symptoms, particularly when correlated with sleep disruption and elevated stress, is a recognized part of the perimenopause picture. The 10th sign is the one most silently suffered, because it lives in the most private part of a woman's experience. And because the cultural silence around women's intimate health means that most women never hear that what they are experiencing is common, recognized, and crucially, addressable. Dryness in sensitive tissues, discomfort in private areas, changes in physical comfort during moments of closeness, a shift in desire, increased urgency or frequency in the bathroom, recurring discomfort in the lower urinary tract without a clear infection, a body that feels different in private ways you were never prepared for. These changes are driven by the same estrogen fluctuation that drives everything else on this list. The sensitive tissues of the lower body are among the most hormone-dependent in the female system. They maintain their moisture, elasticity, and thickness through estrogen support. As estrogen fluctuates and declines, these tissues may lose moisture and become more fragile. The result is dryness, sensitivity, and discomfort that so many women experience and so few discuss openly. I want to say something directly to every woman who has been living with these symptoms in silence. This is not inevitable. This is not something you simply have to endure. There are effective, evidence-based options that can provide meaningful relief when properly discussed with a qualified healthcare provider. But the first step is to say something. To a provider who takes women's health seriously. To someone who can offer real options instead of dismissal. You deserve comfort in your own body. You deserve to feel at ease in your most private moments. You deserve the relief that becomes possible when these symptoms are finally addressed. And the silence ends with the conversation. Now I want to step back and show you the complete picture, because the 10 signs I have described are not random. They are a system. And once you see the system, the experience of perimenopause becomes less frightening and more navigable. Estrogen fluctuates. The hypothalamus becomes less stable, producing hot flashes and night sweats. Night sweats disrupt sleep. Disrupted sleep elevates cortisol. Cortisol drives abdominal fat storage, blood sugar instability, increased appetite, mood reactivity, and brain fog. Progesterone declines, reducing the natural calming effect on sleep and mood. Insulin sensitivity decreases, driving energy crashes and cravings. The gut becomes more reactive, contributing to digestive sensitivity and bloating. Anti-inflammatory protection decreases, contributing to joint and muscle discomfort. Sensitive tissues in the lower body change, producing the private discomfort so many women experience. Skin and hair respond to the changing hormonal environment, and the woman at the center of all of this is managing every one of these changes while also meeting every other demand of her life. This is not 10 separate problems. This is one transition, expressed across 10 interconnected systems, and the response needs to be as comprehensive as the picture. Let me tell you about the natural daily support approach that I recommend to women navigating this transition. And I want to be clear, as I always am, about what it is and what it is not. It is not a hormone replacement. It is not a cure for perimenopause. It is not a substitute for medical evaluation and care, but it is a meaningful, targeted, plant-based daily formula designed to support the metabolic and systemic dimensions of what changes during the perimenopausal transition. 8 natural compounds, each addressing a different piece of the picture I have just described. The first is green tea extract. For women in perimenopause, green tea extract's antioxidant and metabolic support properties address 2 of the most significant challenges of the transition: the increased oxidative stress that drives cellular aging, inflammatory activity, and the metabolic resistance that makes weight management harder, and the metabolic support that a changing hormonal environment requires. Green tea's most studied compound, EGCG, has been researched for its antioxidant activity and its potential thermogenic effects. Used responsibly and as directed, it represents a meaningful antioxidant and metabolic support addition. Important note, concentrated green tea extract in high doses has been associated in some reports with rare liver safety concerns. Always use as directed, and speak with your provider if you have any liver health concerns. The second is apple cider vinegar. The blood sugar instability of perimenopause, driven by declining insulin sensitivity, is one of the primary drivers of cravings, energy crashes, and abdominal fat accumulation. Apple cider vinegar's potential role in moderating post-meal glycemic response makes it a relevant addition to a formula targeting these specific perimenopausal metabolic challenges. Not a medication, not a replacement for medical blood sugar management, but a naturally sourced daily support option for the glycemic rhythm that affects energy, cravings, and belly fat. The third is berberine HCl. Of all the natural compounds studied in the context of metabolic health, berberine has one of the most compelling research records. Its effects on glucose metabolism and insulin sensitivity have been explored in multiple meta-analyses. For the perimenopausal woman whose insulin sensitivity has declined with estrogen fluctuation, berberine represents a significant natural metabolic support option. Critical. Berberine can interact with medications, including diabetes medications, blood thinners, and others. Please speak with your healthcare provider before adding berberine if you take any prescription medications. The fourth is banaba leaf. Banaba leaf contributes to the formula's blood sugar and metabolic support dimension through its chloroxylic acid content, which has been studied in relation to glucose metabolism. As a complementary botanical layer to the formula's central metabolic support approach, banaba adds traditional and research-informed support for blood sugar balance. The fifth is cinnamon bark. Cinnamon's traditional association with blood sugar wellness is among the most recognized in the natural health world. Research has explored its potential effects on fasting glucose and insulin sensitivity, with mixed but often interesting findings. In the context of a perimenopausal woman navigating the blood sugar swings that drive evening cravings, energy crashes, and belly fat accumulation, cinnamon brings a familiar, evidence-informed botanical contribution to the formula's metabolic foundation. The sixth is ginger root. For perimenopausal women specifically, ginger's most relevant property is its digestive support. The gut changes of perimenopause, driven by hormonal fluctuation affecting gut motility and microbiome composition, contribute significantly to the bloating and digestive discomfort that many women experience alongside their other symptoms. Ginger's long history in traditional wellness as a digestive comfort botanical, combined with its anti-inflammatory properties, makes it a natural and specifically relevant addition for the perimenopausal gut picture. The seventh is Korean ginseng. For the perimenopausal woman dealing with the fatigue, cognitive fog, and stress load of this transition, Korean ginseng's adaptogenic and energy-supporting properties are directly relevant. Adaptogens, compounds that may support the body's stress response and resilience, address the cortisol dimension of the perimenopausal picture. And Korean ginseng's traditional and research-supported connections with vitality, cognitive function, and stress resilience make it a meaningful natural addition for the woman whose daily energy and mental clarity have been most affected by the transition. The eighth is resveratrol. Resveratrol's antioxidant and anti-inflammatory properties make it particularly relevant for the inflammatory dimension of perimenopause. As estrogen's anti-inflammatory protection fluctuates, the body becomes more vulnerable to the oxidative stress and low-grade inflammatory activity that affect joint comfort, skin health, metabolic function, and cellular aging. Resveratrol's research profile, including studies exploring connections to insulin sensitivity and metabolic health, makes it one of the most compelling natural compounds for comprehensive perimenopausal support. Let me connect the formula back to the 10 signs: hot flashes and night sweats, supported indirectly through the anti-inflammatory and antioxidant compounds that reduce the oxidative and inflammatory burden that can intensify these symptoms. Broken sleep. The cortisol and stress system support from Korean ginseng, combined with the blood sugar stabilization from berberine, ACV, cinnamon, and banaba, addresses two of the primary metabolic drivers of sleep disruption. Mood changes. Cortisol reduction from adaptogenic support, combined with the blood sugar stability that reduces the energy swings that compound emotional reactivity. Belly fat. Blood sugar stability and insulin sensitivity support from the formula's central metabolic compounds directly address the visceral fat accumulation pattern of perimenopause. Brain fog. The energy production support, antioxidant protection, and cortisol management in the formula address the metabolic conditions that compound cognitive symptoms. Fatigue. The metabolic support, stress resilience, and cellular energy dimensions of the formula address the root drivers of perimenopausal fatigue. Digestive discomfort and bloating. Ginger's specific digestive support addresses the gut changes of hormonal transition. Body aches. Resveratrol and green tea's anti-inflammatory properties address the inflammatory component of perimenopausal joint and muscle sensitivity. This is not a formula for one symptom. It is a formula for the system. And when the system is supported consistently, alongside the lifestyle approaches that complement it, women often find that the cumulative experience of perimenopause becomes meaningfully more manageable. The natural daily formula works best alongside specific lifestyle approaches that are particularly well matched to the perimenopausal body. Let me give you the complete picture. Protein at every meal. Muscle preservation during perimenopause requires adequate protein. Protein also slows glucose absorption, supports satiety, and helps prevent the blood sugar swings that drive cravings, mood instability, and energy crashes. For perimenopausal women, protein is not optional. It is a metabolic intervention. Resistance training. 2 to 3 sessions of strength training per week preserve and build muscle, support bone density, which estrogen previously helped maintain, improve insulin sensitivity, and support metabolic rate. For the perimenopausal woman dealing with belly fat, fatigue, and the beginnings of the body composition changes of midlife, resistance training is the single most impactful physical change available. Sleep protection. Protect sleep aggressively, consistent sleep and wake times, cool bedroom temperatures. Reduced alcohol, which worsens the second half of sleep and intensifies night sweats. Reduced screens before bed, and direct management of night sweats, whether through cooling products, lifestyle adjustments, or medical options, so that the night can do the restoration work the body needs. Stress management. Cortisol is the hidden driver of so many perimenopausal symptoms. Managing stress, not just as an emotional preference, but as a metabolic strategy, directly affects belly fat, sleep quality, mood, blood sugar, and the intensity of hot flashes. Even brief, consistent daily practices produce meaningful cortisol reduction over time. Hot flash reduction strategies, identifying and reducing personal triggers, which can include alcohol, caffeine, spicy foods, stress, heat, and tight clothing, can reduce the frequency and intensity of hot flashes without medication. Medical evaluation. For women whose perimenopausal symptoms are significantly affecting quality of life, the full range of evidence-based options deserves consideration. Hormone therapy, in appropriate candidates with professional guidance, remains one of the most effective approaches to perimenopausal symptom management. Non-hormonal options also exist and have meaningful evidence for specific symptoms. The conversation with your healthcare provider is not optional. Your symptoms deserve professional evaluation. Your relief deserves professional support. I want to tell you about someone. She was 44 when she came to me. She had been experiencing irregular periods for 2 years. Hot flashes for about 14 months. Night waking that had become so normalized, she had stopped mentioning it to anyone. A belly that had appeared in the last 18 months despite no change in her eating or exercise habits. Mood reactivity that was affecting her closest relationships. Brain fog that was affecting her professional confidence. And the persistent, exhausting feeling that nobody, not her primary care doctor, not the gynecologist she had seen once about the cycle changes, had given her a complete picture of what was happening. She had been told different things by different providers. It's too early to be perimenopause. Irregular periods can have many causes. Your hormones are normal. Try stress management. And she had come to me because she had finally had enough of being told individual symptoms did not add up to a pattern that deserved a name. When I walked her through the full perimenopause picture, connecting her irregular periods, hot flashes, night sweats, mood changes, belly fat, and brain fog as parts of one hormonal transition rather than separate problems requiring separate explanations, she was quiet for a long moment. Then she said, "So there is an actual reason for all of this." "Yes, there is an actual reason. And there is a path forward." She began a comprehensive approach, medical evaluation for the full range of options for her specific symptom profile, protein and resistance training as her primary metabolic interventions, sleep protection as a priority rather than an afterthought, stress management as a daily practice, and a consistent natural daily formula addressing the metabolic, anti-inflammatory, and cortisol dimensions of her transition. 6 months later, she described something that I hear often but never tire of hearing. "I feel like I understand what my body is doing for the first time, and that understanding made everything easier to manage." That is the gift of clarity. Not that everything is perfect, not that the symptoms have all disappeared, but that the body makes sense again. And a body that makes sense is a body you can work with. Before I close, I want to be direct about who should speak with a healthcare provider before using this formula. If you take medications for blood sugar, blood thinners, heart conditions, or other prescriptions, particularly berberine can interact, please discuss before starting. If you have liver disease, kidney disease, digestive conditions, or any chronic health issue, speak with your provider. If you are pregnant or breastfeeding, this formula is not appropriate. If your symptoms are severe, particularly heavy uncontrolled bleeding, significant depression, suicidal thoughts, or any symptom that feels medically urgent, please seek medical care immediately. Natural support is powerful and meaningful within its appropriate domain. Knowing when to step outside that domain into medical care is part of responsible wellness, and your health deserves both. If you have been watching this video and recognizing your own body in the 10 signs I described today, if the irregular periods, the hot flashes, the broken sleep, the mood changes, the belly, the brain fog, the fatigue, the skin and hair changes, the body aches, or the intimate changes are part of your daily experience, then I want you to take one clear, simple step. The link in the first line of the description below will take you directly to the guide that explains the complete natural daily support approach for women navigating perimenopause. Inside, you will find the 8-compound plant-based formula, the lifestyle integration, and the daily practices that work with the perimenopausal body rather than against it. And if the description link is hard to find later, the same guide is in the pinned comment below this video, because every woman who has spent months or years wondering why her body suddenly feels like a different language deserves a translation. The irregular periods were not random. The hot flashes were not imaginary. The broken sleep was not weakness. The mood changes were not a personality problem. The belly was not a discipline failure. The brain fog was not the beginning of something serious. The fatigue was not laziness. The skin and hair changes were not just aging. The aches were not imaginary. The intimate changes were not something to endure in silence. They were signs. 10 signs of a transition your body was always going to make. And a transition, once named and understood, is something you can navigate. With the right information, with the right support, with the right daily practice, and with the understanding that your body is not failing, it is changing. And change, met with knowledge, support, and care, can become something entirely different from what it felt like when it began. Click the first link in the description. This is Dr. Audrey Larkwell. Thank you for watching, and I will see you in the next video. If this video finally gave you the words for what your body has been trying to tell you, please subscribe to this channel. Every week, we go deeper into the hormonal transitions, the natural support options, the lifestyle strategies, and the honest, clinical conversations that women navigating perimenopause and menopause deserve. Because this transition does not have to be silent. It does not have to be confusing. It does not have to be something you carry alone. You now have a map, and a map changes everything.